First thing we're going to want to do is move the resident to the edge of the chair or the bed. By doing this, we can have them kind of wiggle to the front. So what we're going to do is have the resident sit upright, and now you're going to take the weight off of one hip by leaning to the other side and move that hip forward. And then shift the weight to the other side and move that hip forward. Once they are to the end of the chair, we're going to have them prepare for standing. The things that we need to consider are feet flat on the floor. Remember, good shoes, nice non-skid shoes. Next, we're going to want hands on the chair or the bed to help push up. We do not want the hands of the resident at any time on you. That makes it unsafe for you and for them. Another thing to remember is to make sure that you have told the resident what we are going to do and what participation you want them to do. What we want to tell them is that we're going to stand, and their participation is twofold: knees straight and hips forward when I tell you. So what we're going to do is put our hands on the safety belt, have the resident lean forward, nose over the toes, and stand, knees straight, hips forward. Once you are fully both standing, you can then pivot or begin ambulation. In sitting, it's just the reverse. You want to back up to the chair till they can feel it at the back of their legs. The hands, as we sit, are going to go to the chair, not onto you. So we're going to slowly sit down, controlling the motion all the way down. So we're going to go ahead and sit down, hands towards the chair. Once the resident is safely placed in the chair, you may then stand yourself. Remember, always watch your body mechanics throughout standing and sitting. Let's review the transferring points that we just discussed. Number 1, use the safety belt. Number 2, instruct the resident as to what they are to do. Number 3, move the resident to the edge of the chair or bed. Number 4, have the feet flat on the floor. Number 5, have the resident stand up using hips forward, knees back. Number 6, pivot after the resident is fully standing. And 7, slowly lower the resident down to the seat. Now that we have the resident up, we can start thinking about moving them from place to place. It's really important to keep your residents moving. We spoke about the physical benefits and as well as the independence thoughts. How much they move is not the issue. It's the fact that they keep moving. So even if it's a short distance, that's fine. We'd like to see if the resident is only moving a short distance, that they have a chance to walk several times during the day and not just be sitting the entire day. When beginning to look at ambulation, we want to watch for weight restrictions, specifically following a surgery. Frequently after surgeries, doctors will insist on a certain type of weight restriction, whether it be partial weight bearing or non-weight bearing. That needs to be considered each and every single time that a resident is being moved. Again, we want to make sure prior to start walking a resident that the area is free from loose rugs, electrical cords, or other things that the resident may trip on. We want to make sure that the resident has proper shoes. That is, shoes that are securely placed on their feet and are flat. Slip-on slippers do not qualify for proper shoes. They need to be shoes that have a non-slip surface on the bottom and preferably that are tied. If they do not have them on their feet, you need to go get them, because walking them without this is an extreme danger. We want to make sure that any assistive equipment that is being used is fit for that particular resident. The equipment does not come as a one-size-fits-all. They're easily made to fit each and every person, if just turning them upside down and pushing a button. When guarding your resident, you want to make sure, of course, you're using a safety belt, as well as the side that you want to be standing on is the weak side. You want to be standing slightly to the side and slightly behind them. This way, in case they would lose their footing or fall, you can safely help them to the floor. In addition, before walking, you want to know the distance that you're going to be walking and if there are any rest spots or chairs along the way, so that you can plan for any unforeseen circumstances. The first way of walking that we're going to discuss is called standby assist. This is for a resident that is not using an assistive device but may need a little extra help from getting from here to there. Sometimes residents normally walk independently, but after a flu or a bout of illness, they may be weaker and need some extra help. Standby assist is perfect in these situations. And of course, you want to be using the safety belt, explain what is happening and how far they are going to be going, and know the distance and if there are any rest spots or chairs along the way. Let's take a look at how you would help guard a person with standby assist. These are for those times where a resident may have had a bout with illness, such as the flu, or maybe after minor surgery, and they have now returned to the facility. First thing we have done is we've placed the safety belt on, and we are going to take our hand in the middle of their low back, come from underneath the belt, and securely hang on to the belt from behind. With standby assist, we can offer our second hand to the resident for them for further stability. When walking, you are going to guard from slightly behind and to the side. The side that is best to stand on is the side that is considered to be weaker. When pivoting, you want to be sure that you are pivoting in a semicircle and not pivoting on a dime. Pivoting on a dime decreases their stability and therefore puts their balance at risk. We are now going to take a look at using the stairs. When ascending or descending a stair, which foot goes first is crucial. When ascending a stair, you first want the stronger or the good foot to go first. So when going up, it's the stronger foot first, the weak second. When descending, it's just the opposite. The weak leg goes first, and the strong second. A way to remember that is when ascending, the good goes to heaven, and when descending, the bad goes to, you understand. Now that we've seen how to help somebody with standby assist and how to go up and down a step, how about the times where that patient has been ill or had a bout of illness and is weaker? What do we do about falling? Let's take a look at what that might look like. Remember, following a bout of illness, such as the flu, stability may be a problem. When walking down a hall, the resident may use the wall as a support. You should be standing on the weak side and guarding them in that fashion. When the resident begins to fall, do not try to hold them up. Lean them against the wall and lower them to the floor. Holding the resident up puts both the resident and you at risk for injury. Be sure to watch your body mechanics as you lower the resident to the floor. Now that we've seen how to safely help someone during a fall, what about using a walker? A walker is used for stability. It offers a great amount of stability, probably the most stability of any assistive device that we have. The important thing to remember with walkers is that all four legs must be on the floor at the same time. It is not a 2+2 type of a device. The walker needs to be placed in a comfortable position ahead, one that does not require bending at the waist from the resident. Of course, we would again be using a safety belt at all times, explain what is happening and how far the resident is to go, and if there are rest spots or chairs along the way. We want to continue to watch our body mechanics throughout the entire time. Let's take a look at ambulation with a walker. In order to fit a walker, you first want to take a look at the handrest to what level it is occurring. We want the handrest to be at the bend of the resident's wrist. This is obviously too tall. So we will take the walker, turn it upside down. All four legs have a little button in which you will push, turn, and wait for the pop. Make sure it's secure. And then chuck it. Do that on all four legs. Fitting a walker is sort of a trial and error. So you fit it